Pranam to everyone. We are going to study anatomy of the thorax and also the important abdomen organs. Let's study the anatomy of thorax. This is Dr. Auroraj, and I hope this lecture is definitely going to help you have a very good concepts about the thorax and the organs of abdomen. Esophagus. This long structure right over here, this is esophagus. It is about 25 centimeter long. 25 centimeter long. It is very important to study the three constrictions of esophagus. First is going to be pharyngoesophageal constriction at the level of C6 and C7. Bronchoaortic constriction at the level of T4. We have diaphragmatic constriction, which is going to be at the level of T10. Yes. It is very important to also know the layers of esophagus. Yes. Now, this image will help us to know all the layers of esophagus. This inner layer here, this is going to be called as mucosa. This is going to be mucosa. And this one, if you see here, this is going to be submucosa. This is going to be submucosa. And this region right over here, if you see this is going to be muscularis propria. It is going to be muscularis propria. This is going to be muscularis propria. And this outer layer, this one, this is going to be called as adventitia. This is called as adventitia. So quick revision, adventitia. We have mucosa, submucosa, muscularis, and then adventitia. These are the important layers of esophagus. Why are we studying esophagus more in detail? Because it will be useful to know all the upcoming diseases of esophagus, which includes esophagitis, inflammation of the esophagus, GERD, gastroesophageal reflux disease, Barrett's esophagus, and also eclasia cardia. We'll study more intensively together in medicine. Now, there is a very important sign which can be seen in eclasia cardia in the radiographic images. If you know it, kindly comment your answers. Stomach. Yes. Look at the image carefully here. This region down here, this is going to be called as cardiac orifice, and this one here is going to be called as pyloric orifice. Yes. The stomach stores 1 to 1.5 liters. Yes, it has a capacity to store 1 to 1.5 liters. Liquids usually gets digested within 1 to 2 hours. Carbohydrates 2 to 3 hours. Proteins 3 to 4 hours, and a little longer for fats. Yes, 4 to 6 hours. Now, the cardiac orifice, this is going to be important for our FMGE exam. It is going to be at the level of T11, at the level of T11, yes. And the pyloric orifice is going to be at the level of L1, at the level of L1. Yes, this is going to be T11, this is going to be at L1. Good. Now, remember, we need to also study about the greater curvature and the lesser curvature. This large area, this area is called as what? The greater curvature, and this is called as lesser curvature. What are the components of greater curvature? It includes greater omentum, gastrophrenic nerve, and also gastrosplenic nerve, phrenic and the splenic. And along with this, you need to also remove the lesser curvature, which is right over here. Yes. Anatomical composition of the stomach is also very important. This area here, this is going to be called as the cardiac part. This region is going to be the fundus of the stomach. This is going to be the body, and this includes the pylori. This is going to be the pylorium antrum, and this is going to be the pyloric canal. So, let's revise: cardia, fundus, body, and the pyloric antrum and pyloric canal. So, it is important to know the anatomy of the stomach as well. Arteries of the stomach. I would advise you to take a piece of paper and draw along with me. Right next to the lesser curvature, draw a small round, which is called as what? The celiac trunk. It gives rise to three important branches. One is going to be common hepatic artery, left gastric artery, and then we have splenic artery. This one right over here, this is going to be called as common hepatic artery. This is going to be the left gastric artery, and this one is going to be the splenic artery. The common hepatic artery, please follow, it gives rise to proper hepatic artery, and then here this is going to be called as the right gastric artery, and then as you see here there's another artery descending down. This is going to be gastroduodenal artery, good. Now, and then it gives rise to right gastroepiploic artery. Down below here you see left gastroepiploic artery, and then here this is going to be the short gastric artery. I think you are very clear. This region is called as what? The lesser curvature, and this is called as the greater curvature. Very good. Now, the lesser curvature, you could see the right gastric artery and the left gastric artery, where in the greater curvature, it's going to be the right gastroepiploic artery, left gastroepiploic artery, and the short gastric artery. So, right gastroepiploic, left gastroepiploic, and the short gastric artery. These are going to be seen there in the greater curvature of the stomach. Very important, please remember. Next, talking about the stomach bed relation. To simplify it, there comes a mnemonic called as DSP. DSP like tasks. Yes. What is the D for? D is for diaphragm. S is for the splenic flexion of colon and splenic artery. Please remember. P is going to be for pancreas. L is for left colic flexure, and then T for transverse mesocolon. One point you have to remember is that spleen is not part of the stomach bed relation. That's it. Good. So this is going to be your stomach, and these are the structures you will see. You will see the diaphragm, you will see the splenic flexure of colon, the left kidney, you will also see the suprarenal gland left, pancreas, left colic flexure, transverse mesocolon, and the splenic artery. This is going to be stomach bed relation. Let's study about HEART, heart, your heart. It has 3 layers: endocardium, myocardium, and the epicardium. Yes, the inner endocardium, the muscular middle layer myocardium, and the epicardium. There is one more outer layer which is covering the heart called as pericardium. Yes, it has 2 important layers: the fibrous pericardium and the serous pericardium. Fibrous and the serous pericardium. The serous pericardium is further divided into parietal and visceral. Very good. Yes. Now look at the second image carefully. This region right over here, this is going to be the epicardium. And this layer, let me change the color. This is going to be the visceral layer. This is going to be the visceral serous pericardium, and this one is going to be the parietal layer of the serous pericardium. In between these two is going to be the pericardial fluid. In between is going to be the pericardial fluid. And what is the amount? It's going to be about 50 ml. The pericardial fluid is going to be 50 ml. Very important. Please remember this. Now, let's study pericardial cavity. It is between the parietal and the visceral layer of the serous pericardium. Yes, we know that. Clear? Contains 50 ml. Good. Pericardial fluid, what does it do? It actually protects the heart and also helps for the heart movement within the pericardium. Let's quickly revise. We discussed about the endocardium, myocardium, and the epicardium, and we discussed about the pericardium also, which is going to have the fibrous layer and the serous layer, which is further divided into parietal and visceral. That's it. So parietal, and we have visceral and parietal, and the fibrous pericardium here. So I hope you have understood the layers of the heart. Since we have just studied about the pericardium, let's correlate to the clinicals. Inflammation of the pericardium. Inflammation of the pericardium is called as what? pericarditis. You can see the inflammation here. It's a condition called as pericarditis. In acute pericarditis, its most common cause is going to be idiopathic. Acute pericarditis, idiopathic. Question 1 to remember. It could be either or it could be viral and rheumatic. The patient might present with chest pain upon resting as well. Just believe someone's sitting or resting and then is still having chest pain. It can be also possibly pericarditis, and especially when the pain radiates to the left shoulder. In MI, you will see a condition called as what? Leaving sign, which is that the patient is going to have left shoulder pain. Now, treatment for viral pericarditis is going to be NSAIDs. If it is a rheumatic pericarditis, you are going to start steroids. So, two important points. You are going to remember what is pericardium. You are going to remember what is pericarditis. If it is viral pericarditis, you just give NSAIDs. If it is rheumatic pericarditis, you are going to give steroids. This was a clinical approach for pericardium and pericarditis. Before we talk about the heart borders, let's look into the heart chambers. This is going to be the right atrium, yes, and this structure here, this is going to be the right ventricles, left ventricle, and the left atrium. Good. Now, towards the left side of the heart, this is going to be the left border, which is going to include what? The left ventricle. Super. And so, the right border here, this includes the right atrium. Remember, left border includes left ventricle, right border includes right atrium. Next, focus. Inferiorly, it includes right atrium, the right atrium, right ventricle, and the left ventricle. Inferiorly, it includes the right atrium, right ventricle, and the left ventricle. Yes. Laterally, if you see, laterally, it includes left ventricle and the left atrium. Laterally, left ventricles, left atrium, and the left ventricles. Laterally, yes. Now, so the left border, left ventricle, the right border, right atrium. Inferiorly, it includes right atrium, right ventricle, and the left ventricle. Hope you get it. Next, laterally, LV plus LV. Great. Now, one important point you have to remember for the exam is going to be about the right cardiac shadow. Right cardiac shadow actually includes the superior vena cava, inferior vena cava, along with the right atrium. Superior vena cava, inferior vena cava, and the right atrium is going to be for the right cardiac shadow. Yes. Next, apex of the heart. Apex of the heart is going to be with the LV, left ventricle, especially at the left fifth intercostal space. Left fifth intercostal space. I hope you're clear with this as well. Circulation of the heart. The coronary sinus gives rise to right coronary artery and the left coronary artery. Right coronary artery, right over here, and the left coronary artery. Good. You can see it here, left coronary artery and the right coronary artery. The RCA begins from the anterior aortic sinus. LCA begins from the left posterior aortic sinus. What does it supply? Now, RCA supplies the right atrium and the right ventricle. It supplies the right atrium and the right ventricle. Yes. Then, it also supplies the posterior part. Remember, it supplies the posterior part, behind part of the left ventricle. It's going to supply the posterior part of the left ventricle, and also the posterior part of the interventricular septum. Good. Now, LCA, it supplies LCA, left coronary artery. It supplies the left atrium and also the left ventricles. Yes. Along with that, it supplies the anterior part of the RV. It supplies the anterior part, you can see, or anterior part of the right ventricles, and also the anterior part of the interventricular septum. Hope you are not confused. Let's revise quickly. The aortic sinus gives rise to right coronary artery and the left coronary artery. Right coronary artery supplies RB, RA and the posterior part of LV, whereas LCA it supplies LA, LV and also the anterior part of RB. Venous drainage of the heart. The coronary sinus is located at the posterior atrioventricular groove. Posterior atrioventricular groove. The cardiac vein, remember, drains to the coronary sinus and to the right atrium. It includes greater cardiac vein, small cardiac vein, middle cardiac vein. The exception is going to be that the anterior cardiac vein drains directly into the right atrium. Remember, anterior cardiac vein drains directly into the right atrium. Abdominal aorta, it is going to be at the level of T12 to L4. T12 to L4, abdominal aorta. Now, this structure we have already studied. It is going to be the celiac trunk. It includes the common hepatic artery, left gastric artery and the splenic artery. Now, remember the common hepatic artery is going to be at the level of T12. It is going to supply the foregut. Very important question. Next, the structure right over here, just below, this is going to be the superior mesenteric artery, also called as SMA. It is going to be at the level of L1 and it is going to supply the midgut. Another question. And here we have the inferior mesenteric artery, which is called as IMA, at the level of L3, which is going to supply the hindgut. So please remember celiac trunk, superior mesenteric artery and also inferior mesenteric artery. It is very important to know the branches as well. Let's start with celiac trunk. We all know celiac trunk has three important branches: common hepatic, left gastric and the splenic artery. Starting with common hepatic. This branch right over here, this is called as what? Common hepatic artery. It gives rise to proper hepatic artery, gastroduodenal artery and the right gastric artery. Please remember this. The gastroduodenal artery further divides into gastroepiploid and the superior pancreatic duodenal artery. Yes. Next, the another branch is going to be the left gastric artery, which further gives branches to the esophagus. And then talking about the splenic artery. The splenic artery, it further divides into left gastroepiploic and then short gastric arteries. Yes, this is going to be for celiac trunk. Now discussing about superior mesenteric artery. Now remember, it is going to be at the level of L1. We have just studied L1. Now superior mesenteric artery, it gives rise to inferior pancreatico-duodenal artery. It also gives rise to the middle colic, right colic and also ileocolic artery. These are the important artery. Along with that, it gives iliac arteries and also jejunal arteries. This is going to be important for what? SMA. Talking about IMA, inferior mesenteric artery, it is going to be at the level of L3. Yes. Now the inferior mesenteric artery gives rise to left colic, sigmoid branches and also superior rectal artery. This has been asked. So this is for you to understand. Kindly take a paper and draw it. You will get it eventually. If you just keep on mugging up, it is not going to help you at all. Kindly take a paper and try to draw the branches of the arteries and it will be in your mind for long. Sternum. I would advise you to touch your own sternum, feel the manubrium, feel the body and also feel the xiphoid process. Yes. Now the sternum includes three parts. It's a flat bone. It includes the manubrium, body and xiphoid process. I hope you can feel or touch your xiphoid process. This will help you to study the content more easily. Now, discussing about the rib cages. 1 to 7 rib, they are called as the true ribs. 8 to 10, they are going to be called as the false ribs. And as you know, 11th and 12th are going to be the floating ribs. Now, talking about the thoracic wall. Anteriorly, we have the sternum. Laterally, we have the ribs. Posteriorly, we have the vertebra. Yes, to make it more clear, this is going to be anteriorly, we have the sternum. This region right over is called the sternal angle of Louis. Posteriorly, we are going to have these vertebra and laterally, we have the ribs. Good. Now, it is very important to also know the first and seventh rib called as true ribs are also called as vertebrosternal ribs. 8th to 10th ribs are called as vertebrochondral ribs. And the 11th and 12th are called as you know, floating ribs. Yes. Intercostal space is between the two ribs. It includes external intercostal muscles, internal intercostal muscles, and the innermost intercostals. Good. Now remember, the innermost intercostal, it has three more muscles, which is called as sternocostalis, subcostalis, and intercostalis intimi. Look at the image here. This one right over here, this is called as what? The external intercostal muscle. External intercostal muscle. And if you dissect this, you will see internal intercostal muscle. And if you dissect further, here you will see such layer muscle, which is called as innermost intercostal, which is further classified into these three. Yes. Now, it is very important to also know the nerve supply. It is going to be supplied by the internal thoracic artery. It is supplied by internal thoracic artery and also the vein, both sides. Good. Talking about the neurovascular bundle, which is very, very important. You see this structure here. This is called as the neurovascular bundle. Please focus here. First one, this is going to be the intercostal vein. It is going to be the intercostal artery, and this is going to be intercostal nerve. It comes with a simple mnemonic, as you can see there very easily. It's going to be called as VAN. The neurovascular bundle, VAN, is located between the internal and the innermost intercostal muscle. Let's look it more carefully. This layer of the muscle is called as what? Internal intercostal, whereas this is called as, I hope you can see, this is called as innermost intercostal. It's between the internal and the innermost intercostal muscle, as you can see these two muscles. Yes, the neurovascular bundle is between the internal and the innermost intercostal muscle. It has been asked several times in the exam. We are going to remember three important arteries of the thorax. One is going to be subclavian artery, anterior intercostal artery, and the posterior intercostal artery. Now remember, subclavian artery giving rise to internal thoracic artery. It gives rise to the anterior intercostal and the posterior intercostal arteries. Now the anterior intercostal artery supplies the anterior region, whereas the posterior intercostal artery supplies the posterior part. Yes. This procedure here, this is called as what? Thoracostomy or chest tube insertion. Yes. Now to do this, we are going to have an incision 2 to 3 centimeters transversely at the mid-axillary line, anterior mid-axillary line, and then you are going to go for the injection anesthetics just above the lower lips, not below, because if you do so, this may affect the neurovascular bundle. Yes. When do you do chest tube insertion? In case of pleural effusion or pneumothorax. Yes. Now you wanted to extract, you wanted to drain these fluids out of the chest. Therefore, you use chest tube insertion. It is also called as thoracostomy. You are going to place the proximal end of the thoracostomy tube, and then once it is done, you are going to put it inside, and then thoracostomy tube suture and its tape is placed after that, following which the drains will come out via the tube. So this procedure is called as what? Thoracostomy or chest tube insertion. How do you do the procedure? First of all, you're going to take the consent from the patient. You're going to follow the aseptic technique. You're going to use the local anesthetics, inserting the drain and securing the chest drain, along with, to confirm, you'll go for a chest radiograph. In which cases you're going to do chest tube insertion or thoracostomy, it is going to be for pneumothorax and pleural fluid. These are two important points to be remembered. Let's discuss about thoracentesis, pleural tab. Very important again. Thoracentesis or pleural tab. As we have just studied, the needle is inserted just above the lower lip, never below, just above the lower lip. As you can see here, it is not inserted below because below we have the neurovascular bundle. Very important to remember. Pleural taping done along the mid-axillary line. Remember, this is at the mid-axillary line at the 7th and 9th intercostal space. 7th and 9th intercostal space. Structures which is going to be pierced at the pleural tab, which is going to be pierced in the pleural tab, is going to be, first we can see the skin and the cutaneous layer. Next, it is going to include the serratus anterior muscle, external intercostal muscles, internal intercostal, and then intercostalis muscles. These are all the structures which are going to be penetrating when you perform what? Thoracentesis, or so called the pleural tab. Diaphragm. Let's study the embryology of diaphragm. Look at the image carefully here. The septum transversum is the one which is going to be getting converted into central tendon. Yes. The pleuroperitoneal membrane. Please remember, pleuroperitoneal membrane is developed into the muscular part. The peripheral margin is developed into the peripheric muscular part, and the dorsal esophageal mesentery is developed into crura of the diaphragm. Now remember, this pleuroperitoneal membrane, if it is deficient, it leads to a condition called as what? Borstelak hernia. It is when the intestine enters the left side of the chest cavity. Could be called as what? Congenital diaphragmatic hernia, CDH. I'm pretty sure you would have heard it. It is due to absence or deficiency of what? Pleuroperitoneal membrane. Please remember, have been asked multiple times. This condition usually presents since birth. It is so very important to study about the embryology of diaphragm. Now, this structure here, this is going to be our diaphragm. Very good. Now, the cervical sockets, myotomes, cervical sockets. C3, 4 and 5 contributes to the skeletal muscles of the diaphragm. Yes. So, carefully you are going to study the embryology and you are going to remember the CDH, which is going to be congenital diaphragmatic hernia, presenting since birth. Diaphragm openings are very easy. It comes with the simple mnemonic VOA, Voice of America. V is for vena cava opening, very easy. It's going to be at the level of T8. What else is going to pass through? Phrenic nerve. In vena cava opening, we have IVC and also phrenic nerve. Esophageal opening, of course, it's going to include esophagus and also gus. Remember, it also having passing of vagus nerve. It is going to be the level of T10. Very good. Aortic opening is going to be at the level of T12. It's going to include the aorta and also azygous vein along with thoracic duct. Okay. So you're going to remember simple mnemonic VOA, T8, T10 and T12. Good. T8, T10 and T12. VOA. Please look at the images carefully. This region is going to be the vena cava opening. This is going to be the esophagus opening, and this is going to be the aortic opening. Great. Your liver is a very important organ. It is a very interesting organ, and we are going to right now study the anatomy of the liver. So this is going to be our beautiful liver. Yes. This lobe here is going to be the right lobe, and this is going to be the left lobe. Yes. Now, liver is the largest gland of the body. Arterial supply is going to the portal vein, which is going to include 80% of it, and the proper hepatic artery, which includes 20%. Most often, the examiner asks about the Cownott's classification. Very, very important. Please know this. It flows clockwise directions. 1, 2, 3, and 4. Clockwise. Just in school days, like first standard, second standard, third standard, fourth standard, just imagine in fourth standard, your class is divided into 4A group and B group. Similarly, right after first, there is going to be segment 4A and 4B. And then we have 2, 3, 4A, 4B, 5, 6, 7, and 8. It goes clockwise. Please, I would kindly advise you to remember this image. Probably draw it or revise it multiple times. It has been asked in the exam several times. Yes. Carnot's classification, very important. The gallbladder is a beautiful organ. Yes, it is, and it's an important organ unless and until one develop to have what? The gallstones. If one patient is starting to develop gallstones, he is going to undergo severe pains. You might have actually heard some of your relatives, friends who has undergone cholecystectomy, removal of the gallbladder. Now, this lecture will help you to know the important points about gallbladder. Please focus. This is going to be the body of the gallbladder. This pouch is called as what? Hartmann's pouch. It can store about 30 to 50 ml. Bile gets concentrated in the gallbladder as well, and the artery is going to be cystic artery. Now, we know this is the liver which secretes bile. This is going to be the right hepatic duct, and this is going to be the left hepatic duct. It gets drained and the bile gets stored here. 95% of the bile is going to be water, and then less than 1% is going to be having bile salts. Remain is going to be bilirubin and the fats. We love burgers, and nowadays we are all eating more of fatty foods as well, oil-rich foods like burgers, cheese, etc., etc. So the moment when we consume our even a typical foods, it gets into carbohydrates, proteins, and lipids. We have discussed carbohydrates take lesser time to digest, and fats takes more time. What is the reason and how bile helps? We'll discuss here. Now, fats, as we know, it's called as what? Lipids. They further gets broken down into triglycerides, the cholesterol, and the phospholipids. Now, and then further divisions, they get divided into polymerase, where the lipase enzymes gets into actions, and then followed by these gets further divided into the polymers, further gets divided into glycerol. Now, the bile can easily emulsify the free fatty acids. Bile cannot go and emulsify the fat, but once it gets broken down, comes into free fatty acids, the bile actually helps to emulsify the fat. So, emulsify the free fatty acids. These are the important functions of what? Bile. Let's look into the extra hepatic biliary contents. We have just known the right hepatic and then the left hepatic duct. It gives rise to the common hepatic duct, which is going to be here. Yes. And then here is going to be the gallbladder just above here. This is going to be called as what? The cystic duct. And then here we have the bile duct. Let's focus. Right hepatic, left hepatic, common hepatic duct. And then we have the cystic duct and the bile ducts. If I just try to show you the back side of the liver, this is how it will look like. It will show you the pancreatic duct, the bile duct, which is going to get to the gallbladder, and also this very important ampulla called as the hepatopancreatic ampulla. Hepatopancreatic ampulla. Yes. Look at there. There is going to be Carroll's of triangle. This region right over here, this is going to be called as what? The Carroll's triangle. Ampulla of Walter or hepatopancreatic ampulla is going to be seen here. You are going to remember the cystic duct, bile duct, hepatic duct, and the pancreatic duct. It's all given here. Try to revise it carefully. Let's study the anatomy of pancreas beautifully. Let's go. Now, the pancreas is going to be 14 to 18 centimeter length, and then width is going to be 2 to 3 centimeters. Yes. We all know from childhood that pancreas has the endocrine function and also the exocrine function. Exocrine function is going to be about the digestive enzymes, which is going to be about also the pancreatic juices. The endocrine function is going to be about insulin and glucagon. Good. Now, studying about the anatomy of the pancreas. Yes, this is going to be the uncinate process right over here. This is going to be the body of the pancreas. This is going to be the tail of the pancreas, and you can call it as the head as well. And here we have the uncinate process. Good. Now, if you focus here, this pancreas is going to be at the epigastric region, the body, and the tail is going to be at the left hypochondriac region. The tail of pancreas is going to be at the left hypochondriac region. Very important. It has what? Exocrine and also endocrine functions. So the pancreas is like this. I'm going to slightly turn the pancreas is like this. I'm going to slightly turn the pancreas towards this side so you can know what is behind. Let's see. Now this region here, as we know, this is going to be this bile duct, and here there is going to be one more duct which is going to penetrate into the pancreas, which is called as what? Pancreatic duct. Yes. And you will see one more duct here which is called as what? Accessory pancreatic duct. Accessory pancreatic duct, and here we have the main pancreatic duct. Good. And these pancreatic ducts, they open into the duodenum, which is called as the papilla, a small opening. The bigger one is called as major duodenal papilla, and the smaller one is called as what? Minor duodenal papilla. We have major and the minor. The major one is called as Wirson's duct, and the minor one is called as what? Santorini's duct. Both are important to remember. Good. This is how the pancreatic enzymes gets produced into the duodenum, which is going to help for digestion. Hope you get it. Discussing about the kidney, we have the left kidney and the right kidney. We all know that the right kidney is little lower and the left kidney is little upper. Let's see it. Right kidney is lower to the left kidney. Left kidney is going to be from T11 to T12, whereas the right kidney is going to be T12 to L3 because of the liver. Yes. Now this is going to be what? The right kidney, and here we have the left kidney. Now remember the kidney's main function. We have all studied this since school days, that it is going to help for plasma filtration, excretion of the waste product, and also for acid-base hemostasis via the unit of kidney, which is called as what? The nephron. Yes. By the way, what is plasma? How does kidney help for plasma filtration? Just assume you're going to inject bloods from your body, and once you're taken the tube, if you put in the centrifuge and if you play the instrument, it keeps rotating for longer times and more faster way, and then once it settles down, the tube will have, first it will have what? Plasma. After the centrifuge, it will include a buffy coat and the erythrocytes, which is going to settle down below. So in the tubes, say for example the tube, the blood is being collected, it has been put in a centrifuge machine, it has rotated very fastly, it will show you the plasma, a coat here, and then the erythrocytes. Now this is called as what? The plasma. Yes. What does plasma have, sir? Plasma has water, proteins, nutrients, and also metabolic waste like urea and ammonia. Yes. And also the electrolytes. Now the kidney, remember, it is going to help for what? Plasma filtration. Very important. I hope you got it. Let's study the anatomy of the liver, the anterior surface. Now look at this. This is going to be what? The right kidney, and this is going to be the left kidney. As you can see here, this is going to be called as the suprarenal area. This one is going to be the duodenal area, hepatic area, colic area, and the jejunal area, where jejunum is going to pass through. Next, towards the left kidney, you will see the splenic area, gastric, pancreatic, jejunal, and also the colic area. Very important. Yes. Now you're going to see suprarenal, hepatic, duodenum, colonic area, suprarenal, spleen in this left side, gastric, pancreas, and jejunum. These are the anatomy of the left kidney, and this is going to be for the right kidney. Good. Now remember, renal artery and renal vein. Renal vein, it drains into the inferior vena cava. Left gonadal vein and the left suprarenal vein, they actually both drains into the left renal vein. They drain into the left renal vein. Yes. Pelvic diaphragm, very important muscle. It's going to be levator ani, which includes the iliococcygeus and pubococcygeus. Let's go. This muscle right over here, this is called as pubococcygeus, and this one right over here, this is going to be iliococcygeus. Yes. This muscle is called as the coccygeus, and this is going to be the piriformis muscle. I hope you are able to clearly classify the muscles. And this one is going to be called as the puborectalis, and is close to the rectum. Yes. Okay, now hold on to this. Now look at the image once again here. This muscle right over here, this is going to be the pubococcygeus. These ones are going to be the iliococcygeus, And then you are also going to focus on the rectal canal, where you will see the puborectalis. In female, you have 3 openings, which includes the urethral opening, vaginal opening, and also the rectal canals. Yes. Now, urogenital diaphragms, please remember the deep transverse perineal muscles, inferior fascia, superior fascia, and the sphincter urethrae. These are the important ones to be removed for also urogenital diaphragm. Yes. We have just studied about the kidneys. Yes, let's now try to learn about the urinary bladder. Yes. It is derived from urogenital sinus. Question number 1. It is oval in shape. Oval in shape when it is filled. It has 130 ml normal capacity. One start to micturate when the urine is going to be stored for about 300 ml. Micturation starts. Pain in the perineal region happens when it is about 500 ml. It's going to have pain. Yes. Now it is also very important to know the nerve supply of the bladder. Important nerve is going to be the parental nerve. This one is going to be the parental nerve, which is going to supply the external sphincter. Very important. Followed by we have parasympathetic nerve, which is going to supply the body. And we also have the hypogastric nerve, the sympathetic nerves, which is going to be from T10 to T12 supplying here. So please remember the hypogastric nerve and also the parental nerve. These two ones are going to be very important. Let's discuss about the Wolffian duct and the Mullerian duct. Wolffian duct, remember, it is going to be forming the male genitalia. Mullerian duct, it is going to be forming, remember, U for uterus. Mullerian duct, it is going to form the female genitalia. Yes. Now look at the image carefully here, which is going to be very important. The blue duct, this is going to be called as the Wolffian duct, and the red one is called as the Mullerian duct. Yes. When there is the presence of testosterone, the male hormones, it gives rise to male gonads. When there is absence of the male hormones, it is going to lead to giving rise to female gonads. The male gonad will continue to give what? Epidermis, testis, vas deferens, and the seminal vesicles. And the female gonad will have ovary, oviduct, uterus, and the cervix. Yes. Let's go with the important points. Wolffian duct forms the male genitalia. It is also called as mesonephric duct. Yes. A remnant of the Wolffian duct of female is called as what? Gartner's duct. Gartner's duct. Very important. Now, Mullerian duct forms the female genitalia. It is also called as paramesonephric duct. Very important. Yes. It forms the fallopian tube, uterus, upper part of the vagina as well. So please remember these important points of Wolffian duct and the Mullerian duct. Yes. Hi, this is for you. If you have watched the video completely, you are definitely putting a lot of effort to learn more. Every small step that you take these days is going to be a stepping stone for your success. I really appreciate your hard work. Keep studying well. You are going to pass. I wish you a very good luck. Not only just luck, but also to have the determination that you will maintain the consistency and that you're going to finish the exam by this December 2024 and get it cleared and live your dream life. This is Dr. Auroraj. Love you all. Thank you.